Hey everyone! Today we're going to master a crucial nursing skill that you'll use all the time, and it's one you'll definitely see on the NCLEX, discontinuing a peripheral IV. We're going to walk through this step by step, really focusing on the safety and the clinical judgment that makes all the difference.
Now, I know this might seem like a really basic task, but don't let its simplicity fool you. If you get this wrong, it can lead to some really serious complications for your patient. This is one of those procedures where every little detail matters.
Okay, so here's our game plan. We'll kick things off with why this is so important. Then we'll cover the pre-removal safety checks, the removal itself, and what to do in an emergency. Then we'll wrap it all up with post-removal care and the key things you absolutely have to know for your exams. So, first things first, let's talk about the why. Why do we have to be so careful with something that seems so simple? Well, because understanding the risks is the absolute best way to prevent them from ever happening. You've got to remember these 4 big risks: infection, bleeding, pain, and emboli. Every single step we're about to go over is designed specifically to protect your patient from these 4 things. So don't think of it as just a checklist. Think of it as a critical safety protocol. Okay, with those risks burned into our brains, let's talk about what has to happen before you even get near the patient. These pre-removal checks are your first line of defense against making a mistake. Look, these 3 things right here, they are absolutely non-negotiable. You verify the order to prevent a massive error, you follow infection control to protect both you and the patient, and you explain what you're doing to build trust. On an exam, if you skip any of these, it's an automatic fail. Simple as that. All right, time to get hands-on. Let's walk through the actual procedure. I'm going to break this down for you into 3 really simple phases: preparation, dressing removal, and finally getting that catheter out. First up, you gotta stop the flow. It sounds so simple, right? But why does it matter? Well, closing that clamp means no IV fluid spills all over the bed, which keeps your area clean and saves you from having to do a linen change later. Okay, now this next part is super important, especially for your skills checkoff and the NCLEX. You always stabilize the hub to keep it from wiggling around. But here's the golden nugget. You pull the dressing toward the insertion site. Pulling toward the site prevents vein trauma. It's a small detail with a big impact. Okay, listen up, because this is a huge and dangerous mistake people make. Let me be crystal clear. You never, ever apply pressure directly over the catheter while it's still in the vein. It hurts the patient and can seriously damage the vessel. Pressure comes after the catheter is all the way out. And here we are at the single most critical moment of this whole thing. The catheter comes out smoothly, and your eyes, boom, go right to the tip. This isn't something you check later. It's an immediate safety check. You have to ask yourself, is the tip intact? All right, let's pause here for a quick NCLEX-style brain teaser. The catheter is out. In this exact second, what is your number 1 absolute immediate next action? Your answer to this question determines whether this is a routine procedure or a medical emergency. And that question leads us right into our biggest what-if scenario. What do you do if you look at that tip and a piece is missing? I can't say this strongly enough. If that tip is not intact, you are in a medical emergency, period. That little piece of plastic can travel through the bloodstream and become an embolus, potentially lodging in the heart or lungs. What you do next is critical. So what do? Your response has to be fast and it has to be right. You apply a tourniquet high on the limb to try and trap that broken piece and stop it from traveling, and you notify the provider immediately. There is no time to think about it, you just act. Okay, deep breath. Let's rewind. Let's say the tip was intact. The emergency is over. Now we're back to our routine post-removal care and assessing the site. So you've applied pressure, you've got a bandage on there, but your job's not done. Now you've got to be a detective and look for these classic signs of infection. Catching this stuff early is key. So what if you see those signs? First thing you do is notify the provider. But here's what makes you a great nurse. You're already thinking 2 steps ahead. You know they're probably going to want cultures, right? This is why it's so important to save that catheter. Be ready with sterile scissors and a sterile container because you'll likely need to send that tip to the lab. All right, let's wrap this all up and lock it in for your exams. This is where we focus on what you absolutely need to know to walk in there and feel confident. Seriously, look at this slide. This is your study guide right here. The stuff on the left, that's safe practice. That's how you pass. The stuff on the right, that's where errors happen, the kind that can hurt a patient and cause you to fail a question. You have to know the difference. Okay, if you walk away with just one thing today, I want it to be this memory anchor. This sequence is everything. Say it out loud, write it down, whatever you need to do. Order, clamp, stabilize, pull toward, inspect tip, assess site, culture if needed. Burn that into your brain. It's the key to safe practice and acing your exam questions.
And let's finish up with one last question to test your clinical judgment. You see the site is red and draining. You've already called the provider. Now what? What are you anticipating? A great nurse anticipates the next order. And based on what we just covered, you should be getting your sterile scissors and a sterile container ready for that culture. That's thinking like a nurse.